And good evening, everyone. I'm Professor Jennifer Harrison-Hauer, and this is our week 6. Let's get right into it. The weekend is here. All righty. Let's get into our drug classes. Drug classes affecting the respiratory system. I think I fixed everything to where you're not going to be seeing my notes. So then, Kaylee, are you able to see the next slide?
Nope, I cannot.
All righty. Life is good. Let's get into it. So first we're going to go over a few different things today. Upper respiratory disorders, your common cold, if you want to be really sound nursey, is caused by the rhinovirus. It affects the nasopharyngeal, which is your nose and your throat. And so this area up here. Acute rhinitis is when you have inflammation of the nasal passages in your mucous membranes, your nasal mucous membranes. Allergic rhinitis is a type of inflammation of the nasal mucous membranes that's either caused by pollen, when folks have their hay fever and their allergies. Now, with the common cold, we're just doing a little bit of a review here. You're contagious 1 to 4 days before you even know that you have symptoms. And that by the time that you show symptoms, the first 3 days of the cold, you're also contagious, which means you can spread it to others. We're just doing a little bit of a review. Transmission, if you're touching a surface and touching your nose or mouth, if someone sneezes and you get some of that droplet into your nasal airway and into your mouth, then you could get that common cold. I think we've all had it. Our nose becomes congested. There's coughing. There's a lot of mucus secretions. I like this slide. I actually added it in because it's important to realize that with the common cold, you do not treat it with antibiotics. It's what we call supportive care. Drink plenty of fluids. You treat the symptoms. You get lots of rest. Eventually, you will survive it. So now let's get into our first class of medications, and this is our antihistamines. So these guys work because they actually compete with that histamine receptor. Remember, we learned a few weeks ago, it's all about that receptor site. So there's a histamine receptor site. So these guys are antihistamines. And so they want to block the H1 site. Okay, and by doing so, it decreases secretions in that nasopharyngeal area. You have first generation. There's first generation, you may hear second generation, and as you further your nursing career, all that means is that first generations, they were created first. So these are the original, the OGs. So as far as the antihistamines, if you notice, they tend to have, any of your first generations may have more, they usually have more side effects. They came out first. It wasn't perfected, if there's such a thing as perfection. So these guys tend to cause more, first generations, more of your side effects like drowsiness, dry mouth, urinary retention, blurred vision. Again, they're great drugs. It's just that they have side effects. More so than the second generation, which came along later, these guys have less drowsiness and less anticholinergic, which is everything that's listed on the first generation. These guys have less of those. And so this is a common antihistamine. I actually put the picture in. I was going to put the one with the B, Benadryl, but I don't want to pick on Benadryl because Benadryl, like Tylenol, is a trade name. We're dealing with generic medications. And the active ingredient for antihistamines here is diphenhydramine, okay? And then it works on allergic rhinitis, itching, hives, the common cold, sneezing. It actually says, I've never taken it to prevent motion sickness, but that's one of its uses. It's important to know, specifically if they write down here that you do not want to give it to someone who has closed angle glaucoma, is a type of glaucoma, because it probably increases the pressure. We're not going to get into that pathophysiology part of it, but just know it's contraindicated in someone with glaucoma or severe liver disease. It interacts with depressants and alcohol, increases the central nervous system depression. So you got to educate folks not to drink alcohol, be careful with their driving, or if they're taking other things that are already depressing that central nervous system. It can interact and make it go even more, uh, have even more concerns there. So as far as clinical judgment for diphenhydramine, you want to make sure that you give the oral form with food to decrease any stomach upset. You want to warn the patient about the driving, and you would think people know a lot of these things, but you're just going to say it over and over again because you want to document that you told them this. You don't want to drive with it. You want to make sure that you avoid alcohol or any medication that can cause central nervous system depressants, or mixing. That's how things happen with people and they have accidental overdoses. Um, and then mouth dryness as far as gum and ice chips and that sort of thing. And you want to evaluate the response anytime you have a medication, their response to that medication, if it relieved their symptoms or not. Now, when we're talking about nasal congestion, etiology means what happens. And what happens when your nose becomes congested is that the blood vessels in your nasal passages actually dilate and they swell. And by doing so, it stimulates the alpha adrenergic receptor. I'm sorry, that's how etiology is the cause. So when you have your nasal congestion, your blood vessels dilate and they swell. The decongestants work by stimulating that particular receptor, which is the alpha adrenergic, and it constricts it and it shrinks the mucous membranes, and that's how it decongests a nose that's congested. And so it's really great for your allergic rhinitis, inflammation of the nasal passages, or infection. Now, stay with me, you're doing good. Expectorant, a great way to remember expectorant is that I expect you to cough up something. I don't know, whatever works for you. How does it work? It lubricates the airways, it thins the mucus so that you can bring that phlegm up. It loosens those secretions. If you've ever coughed up something that looks like pudding, you need an expectorant. And you need to drink lots of water. It's one of the over-the-counter things we recommend for a common cold. If they're coughing up a lot of phlegm, this is one of the things that's recommended that you take to help you with that. But nothing is without its side effects: drowsiness, dizziness, headaches, nausea, vomiting, that sort of thing. Now we're moving to intranasal glucocorticoids. These guys are nasal medications that are used to reduce inflammation, which is redness, inflammation, and swelling in your nasal passages. It decreases that rhinorrhea, which is the runny nose and sneezing and congestion. Somebody that has seasonal allergies, they're taking some kind of Beckinase, some kind of a spray to help them as well. They may be taking a pill too, but it's really good for those who have allergic rhinitis, those seasonal allergies, the coughing, the sneezing, and their nose is running and it's just pouring out. Again, you've got side effects. Candidus is yeast. So a steroid, one of the side effects, common side effects, anybody that's taking steroids, it can build up yeast. And I'm not going to get into candiasis, but that's what it is, if you're curious. Antitussives, these are medications, tussive is cough. So these are medications that suppress your cough. If you're having more so, more so dry cough than an expectorant, but I don't want to confuse you right this second. But it works specifically on your cough reflex is actually in your brain, your medulla, which is part of your brain stem. That's where your cough reflex center is. So it's not working with a receptor, it's actually working with your medulla to suppress the cough reflex. And any non-opioid means that it's over the counter. Anybody can buy it. Opioid is prescription. And then there are combination cough syrups where, let's say, if you take Robitussin, that's over the counter, but they make a medication with Robitussin with codeine. So just because it's a combination, if it has something that's a narcotic, it has to be a prescription. And this is just a visual picture that I added in. So you can actually see the mucus that's in those bronchial tubes and how that person is really trying to get that stuff up. If it's thick like that, they're going to need, they can drink water to thin the mucus and then an expectorant to help because it's got to come out. It's going to lead to like pneumonia and things. Now, I added this slide in to just maybe it'll help you guys. Antitussive is used to prevent cough. Tussive is cough. Expectorant, that's, yeah, it can be used for cough, but someone that has a cough that's wet that you need to bring up that stuff from their lungs. If you give them an antitussive, then it may help the cough, but it's not going to help them bring up the stuff that's inside that they need to bring up and they're coughing as well. Okay. And then we're going to talk about sinusitis and pharyngitis. So sinusitis, these are your sinus cavities here. Anybody ever had sinuses? Inflammation of the mucous membranes of your sinuses. Usually treat with a decongestant, Tylenol, fluids rest, and an antibiotic. This is the first time we really brought that in. So it is, if someone has sinusitis, they need an antibiotic for that, as well as all these other things to help them with because they usually have a lot of pain, so they need something for help with the headache and a pharyngitis, acute pharyngitis, any itis is like a inflammation. And so it's inflammation of your throat. It's not strep, and I want to get into different types of conditions. It literally means inflammation of your throat. And if you notice, and they'll do different tests, like they'll swab your throat and all of that, but it's supportive care. You got to gargle, throat lozenges, and fluid. There's no antibiotic for this. That is the treatment. Now, specifically for nasal decongestants, there's sprays, there's drops. I've never seen a tablet, but I guess there's a tablet, capsules, liquids as well. Tablet, probably nasal spray, nasal drops, tablets you take, capsules and liquids will help with decongestion. I'm thinking like a Sudafed or something. But anyway, if you've ever taken a decongestant, you get kind of like jittery. For some folks, restless. The rebound nasal congestion, and this is really important, I put it in like bold, is because if they continue to take, and usually it'll tell them, if you take Afrin for more than like 3 days, it's actually going to it's going to rebound and make your blood vessels and your nasal passages become sensitized, used to it, and it actually will make it worse. So it's usually only for nasal decongestants are usually for just a very, 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 very short period of time. It's overuse. Rebound is you're using it too much and it's only supposed to be for like a short period of time. And then you have to stop using it. You gotta pull it away from them. And if not, they'll come back, it's not working. I'm like, well, you've been using it for 2 weeks. So anyway, it does interact with caffeine. If you can think with caffeine and you're nervous and you're jittery, it'll make it more so. MAOs are a type of medication class used to treat depression, anxiety, Parkinson's. So if someone's, you got to let them know, try to limit your caffeine or avoid taking caffeine if you're taking a decongestant. Knowing if they're on a type of MAO. This is all for the doctor provider to know, but you have to know too, because you're going to give them medication. And beta blockers are a common type of anti-blood pressure medication. So as far as a nurse is concerned, educate them on limiting or decreasing their caffeine while they're taking it, and careful with any medications. That's why you let people know what medicines you're on, so the doctor will know, or the provider, if you're taking an MAOI, and they'll know if you're taking a beta blocker. But you have to, they can leave your hospital and go to their psychiatrist, and they need to let them know everything they're taking, even a nasal spray. And so your clinical judgment for your decongestions is that knowing that you want to know their, again, history of high blood pressure as well. You want to be aware if they're knowing that a nasal decongestion can lead to decreased gas exchange. It's just one of those things, especially if they're already congested, they have a lot of stuff in there, they're having difficulty breathing. Therefore, if they're having difficulty breathing, that decongested on top of their already congestion can stay with me, constrict their blood vessels in their nasal passages, all right? And it's potentially can reduce their airflow, and then they already got gunk in there. Now, what does that mean? What does that mean is that although this may occur, okay, we're not trying to scare people, it's usually mild and temporary. So what does that mean? You're going to do your vital signs, you're going to check and see, how they're doing. Doesn't mean you're not going to give it, but if this occurs, you should be aware of it, okay? And of course, the goal is that their cough will be gone. You want their cough to be eliminated or diminished. So nursing, your documentation, observe the color of the stuff they're bringing up, teach them how to properly use any medication, the nasal spray, of cautioning them about prolonged use of it. And usually we'll say on there not to exceed 3 days, but to remind them, drink plenty of fluids, inform them that the common cold and flu viruses are easily transmitted by hand-to-hand contact. So people need to wash their hands, clean their surfaces, and of course, evaluate the outcomes of their medication. My favorite part, SpongeBob, critical thinking. And here we go. All right, SpongeBob, do not lead us astray. Number 1, Kaylee, can you read it and answer it? Everybody else type your answer in. We're all going round robin. Where did Kaylee go? All right, I guess it's Peace. Are you still with us? Peace. Says Peace, Marlet, Kaylee, Hannah, Shandani. All right. I think Peace pieced out. Marlet. There's Kaylee.
So sorry.
Kaylee, can you do the first one? And then everyone read it and type your answer, but we're going to all take turns answering the question. So the first one is up to you. It's on you, Kaylee. Lead
Great.
us on.
Okay, let me read it. Sorry, I was in the back.
Go ahead. No, go. You can read it out loud if you want to.
Okay, I would choose C.
Marlette and everybody else, did you guys choose, anybody else choose something other than C? And you are correct. Excellent. Marlette, you're not next. Everyone else type your answer into the chat box.
I'm gonna go with A and B.
Anyone else have a different answer? C, D? Hannah, you still thinking? You got that face going on.
I don't know what that drug is, to be honest.
I could tell you, but we just talked about it.
The name of it too?
Mhm.
Oh, okay, sorry.
Did we not talk about it? Or was I not there?
I
We
don't
did.
think so.
Oh my gosh. I thought we did. Oh, it's a cough syrup. It's a cough syrup. My bad. Now do it. Unless you bought it at Walmart, you probably wouldn't know. It's the active ingredient in Robitussin. You guys good? You're still looking? Okay. The correct answer is take the drug with a glass of water and read the labels on over-the-counter drugs and check with healthcare provider before taking cold remedies. But again, you would need to know that that's what that is. Not sure. I thought it was in your text, but anyway, taking the drug with a glass of water can help loosen the secretions. Labels should be read, and the healthcare provider should be checked with to avoid conflict. Cold medicines should not be taken at, it says at bedtime, but I don't know why I take mine at bedtime. Okay. All right, Miss Patel, you're up next. Everybody else type your answer in, please. Whenever you're ready, no rush.
Okay, so a common cold, would it be an antihistamine?
No,
No. Okay, let me try again.
give me one more guess.
Okay.
Common cold should be a clue.
I think I'm overthinking it.
I think you are. Let me help you a little bit. So a patient was diagnosed with a cold. So you come into my clinic and you're like, oh, I got runny nose, cough, congestion, nasal congestion. And I said, oh, you have a common cold. Remember that slide I had that I had up there with all the different things to give to treat with a common cold? Like there was an echinacea flower, there was Tylenol, acetaminophen. So which drug should the nurse question if it is ordered to treat this patient? Which means you're going to be like, why did this doctor or nurse practitioner order this? They have a cold.
An antibiotic?
Yes.
Okay. That's what I thought it was, but then I was going back to the
Bec-
antihistamines because that's
No, no,
what I
no,
had
no,
on my notes.
because you wouldn't question that. You wouldn't, everything up there is what you would, or you can reverse it in your mind. You could say, what should this patient be taking for a common cold? You can reverse it. It's okay to do that in your mind with the question, but you got to be careful how you flip it.
Okay.
So, pretty good, pretty good. All right, moving on. The common colds are caused by the rhinovirus. Antibiotics will not be used to treat a virus. Miss Hannah, which drug is a first generation antihistamine? Type your answers.
I would say C,
C?
diphenhydramine.
Absolutely
Yes.
correct. I threw so many hints. Oh my goodness, I was like throwing a softball. Phew. Anybody else have anything different? You wouldn't tell me if you did, but that's okay. It's a first generation antihistamine or Benadryl, but I don't want to say the Benadryl world because it's a trade name. The active ingredient is diphenhydramine. I could have Professor Harrison-Hauer's diphenhydramine. It's a first generation. Nobody's gonna buy it because they're like, what is this? But that's why I put that little pink box, because you can find it anywhere. We don't stop when we're tired. We stop when we're done. Okay. Going back to Kaylee. Everyone read it and type your answers, but Miss Albertson will lead the way.
I think it's 3 days.
Anyone have anything else? Hannah's shaking no. Patel, Miss Patel? You okay with 3? Not 10, not 14, 10? Medina? Okay. Somebody was listening. Result in rebound nasal congestion. Instead of the new, it'll make it worse. You got to stop it. Okay. And then Miss Medina.
C. Close angle glaucoma.
Okay. All right. Calm down. I'm just kidding. Excellent. You're like, I don't need to think about it. I listened. Very good. It's contraindicated that. All righty, Miss Hannah. Which statement about, okay, so you don't know what benzonate is. Let me just help you with that because, well, it should, does anybody remember it from their chapters? And if you don't out yourself. No? So benzonate is a cough pill. It looks like a little lemon head. It's called, one of the names is Tessalon Pearls. It's a really common, it's not a narcotic, it was a prescription, but so I'll help you with this one. Which statement about benzonate, anyway, does the nurse identify as being true? Is it an opioid antitussive? It suppresses the cough center of the medulla. It suppresses respirations. It causes physical dependence. Eliminate C, eliminate D. And you're gonna think, what is it? Yeah, so it's a non-opioid antitussive. It suppresses the cough center in the medulla. That's the only one for me that, I don't know, maybe because I've been doing this for a minute. It's like, didn't we just talking about suppressing the cough center in the medulla? That just sounds like, anyway, it's just me. And we're done. Can you guys believe it? We are done. This is your respiratory chapter. I am going to stop recording.